Well, hello everyone. Welcome to episode 10. Yes, episode 10 of the Caring Neurologist. This is the future of genetic therapy in movement disorders. I'm going to start by welcoming our beloved Dr. Sandeep Thakkar. Thank you so much, Dr. Sandeep, again for all the information you give us.
Thanks, Ursula. I'm excited that we get to keep this journey going. I keep hearing about people who've been listening to the episode 9 and even looking back at even the DBS episodes. So we keep getting good feedback, and I'm loving what people are saying.
Well, I don't know if you know, but it's one of the biggest health podcasts in many streaming platforms.
Well, we've got a good team. Thanks to Top Health, and thanks, Ursula, for what you do and the way we interview. And I think we keep it as simple as we can, and we're passing that information out.
Absolutely. Okay, so let's dive right into it. Let's dive into the future of genetic therapy in movement disorders. Let's begin with an introduction to gene therapy, if you think that's a good thing to do to begin with. So when we say gene therapy, it almost sounds like science fiction. Actually, I think it can be a little intimidating to some. But in simple terms, let's just break it down as we usually do. What exactly is gene therapy, and why are experts calling it the next frontier for Parkinson's care?
Yeah, so it can get very complicated. Gene therapy thus far, it's actually led to amazing breakthroughs in other hereditary or genetic causes for neurological problems. So we actually have other diseases called spinal muscular atrophy that causes certain conditions of the muscles to atrophy, and we've had gene therapy work for that. We've had genetic causes of blindness called Leber's optic atrophy, and we're using gene therapy to help cure blindness. So we're doing the same thing with Parkinson's, because no matter how our skin color is, our color of our eyes, it all is based on genetics. And what you got from mom and dad, we combine these genes to get DNA, and that DNA then creates something called mRNA, which then causes proteins to develop, and then that's our cells. So gene therapy is helping and being innovative to get to the root of a problem. For instance, there again is about 13 to 15% of genetic causes for Parkinson's that we know of at this current time, right? 2025, we know about 15% of Parkinson's is genetics. So if we know that there's a genetic issue, we can actually modify the gene where there's a specific problem, like using scissors and cutting out the problem of the gene, whatever that message is, and then replacing that message. So with gene therapy, again, it's innovative. It's a treatment strategy that addresses the root of the problem. We manipulate the gene that's expressing the abnormal protein that's then creating the problem of what we call alpha-synuclein. And as you guys know, the cause of Parkinson's is the spreading of the abnormal protein alpha-synuclein. And then now we can actually go after and target the cells or the problems in the brain where they're accumulating. So again, there's other ways of looking at this. If you want to go real simple into gene therapy, is that even though we're thinking about the future, it's actually present. We're working on it right now. We're actually having clinical studies that are working on, but we can turn off the abnormal genes. We can modify the genes. We can enhance the dopamine producing cells that are being created. We can support the nurturing of these cells. And so the way I look at it is gene therapy is like fertilizer. It's just coming in to help support the areas of the brain that need it. And that way we can regulate or deregulate the abnormal signals.
So if I say that changing or adding genes would help someone with a movement disorder, am I saying it right?
Yep. And again, we're not changing every aspect of someone's genes. We're just targeting very specific problems. So we know that, for instance, let's just say, Ursula, you're making cookies, right? And you're reading a recipe. And you're reading the recipe and you put a certain amount of flour, you put a certain amount of sugar, you put a certain amount of chocolate chips, and then somewhere accidentally in the recipe it says add cinnamon. But some people have a sensitivity to cinnamon. So what happens is, think of genetic therapy or gene therapy, that we come in and we can just erase the recipe component of cinnamon, and now you can still then continue to make your recipe, right? So what gene therapy does is it cuts out what you don't want and allows us to continue the process to, again, make what we want. And so again, the body still always is creating is using genes to create new proteins. And then again, what we don't need, we're taking out. What we do need can still continue.
That's amazing. So when people hear about gene therapy, many also think of gene editing or buzzwords like, I think it's CRISPR or CRISPR. So can you explain the difference? Because in Parkinson's, are we talking about editing someone's DNA? Or is it more about adding a helpful gene into the brain? How does it actually work in practice?
Yeah, so in practice, the way we look at it, there's different things that we have treatments, right? Like right now we have medications that you can take and then it just gives you maybe a certain chemical in your body. Or if we think about, like, say, stem cells, we're giving cells to help reproduce. Right now, what we're actually doing with gene therapy is a total opposite perspective. Is we are actually going after the root problem of the disease, where the body is making abnormal cells, okay? And when it comes to like words like CRISPR and things people may have heard of, we're actually modifying the DNA that's abnormal. So we are engineering the gene, okay? And the specific problem gene. Remember, we have lots of other genes. You still, even if there's a modification of one gene, you still have, blue eyes, or you still have brown eyes, and you still have black hair. Whatever it is, those things don't change. We're just going after one specific cell that's creating abnormal protein. So the way we think about it is, again, it's like a molecular scissor. We come in and we cut off some abnormal part, or we're adding in somewhere a proper gene or correcting the gene. So CRISPR, for instance, it stands for cluster of regular interspersed short palindromic repeats, right? So all this is a fancy word, medical term that we use for technology and research, where we are actually opening up and then implementing a gene and then letting the body create that recipe to then make the correct gene. So again, the body is the cook. It's creating recipes, and we're adjusting the gene so that we can create the right growth factors for dopamine. So then dopamine cells can be made properly. We create the new fibers that the pathway that was genetically abnormal is healing. So the way we look at, again, gene therapy is we are then also, maybe lacking enzymes that help dopamine growth in these areas. So we actually have to, with gene therapy, implant the genes or these gene therapies into the area where there's abnormalities. So whether it's in the brain, in the putamen, or in the subthalamic nucleus, we work with the neurosurgeon, and we implant these genes to the correct area.
I once heard that there's no such thing as a stupid question, so I'm gonna go ahead and ask.
Sure.
How do you know which gene you should cut?
Yeah. So the reality is, when you get a blood test, we're looking at certain specific results, right? We're looking at hemoglobin, or we're looking at, certain aspects of sodium levels. When you are dealing with like a urine infection, you get your urine tested, you look for bacteria, you see what the bacteria is. Same thing goes with genes. We know that there are certain genes that exist. Right now, we're doing certain studies, and there's 2 actual gene therapies going on right now. So we can actually test for those genes and seeing if someone has an abnormal version of them. So we can actually do a blood test to say that this person has this abnormal gene. And then once we have that gene, we are actually then going after what the problem is of that gene. And we can test for it in the lab, and we can see where the issue is. And it's actually very straightforward because we know what normal is. And there's been, years and years of what we call like genetic mapping. And it was done at UCLA. And we actually know the actual map of the body for genes.
That's amazing. It does sound like science fiction. Let's go. Let's dive into advances in Parkinson's treatment. Okay. So let's talk about the breakthroughs happening right now. I know that there are exciting trials underway. For instance, one experimental treatment targets do tell me if I pronounce it the wrong way, the GBA1 genetic mutation in Parkinson's. And there's another one that uses a virus to deliver GDNF, which is a protein, I believe, that helps nourish brain cells.
Yeah.
So that was okay, right?
Yeah, it was good. It was good. And so number one is I want to make sure gene therapy, we're using it in so many things, right? Like we've cured certain degrees of blindness at this moment in time. There's actual disorders of blindness that is created by genes, and we are able to modify those genes so that people who hadn't seen once in their life, and all of a sudden now they can see. We use actually gene therapy in crops, okay, for like actual harvesting. Sometimes there are crops out there that need to protect against certain types of bacteria or fungus, and so you can actually modify the disease, like those crops that are now disease resistant. So there's a lot of use already and has been used. So what we actually do is, you talked about a virus delivering certain things. How we actually simplify and actually get the correct gene is we do a special coding of these correct genes through a virus, and that virus gets into the DNA, and that's how we actually create the correct proper signaling so that the genes can work. So for instance, right now there's actually in Parkinson's, 5% of patients with Parkinson's have what's called a GBA1 mutation. And that's current right now that we know of, okay, GBA1. And what GBA1 is, it's a gene that encodes for lysosomal enzyme glucocerebrosidase. Now that's a handful of words in one sentence, but lysosomes help with clearance of abnormal cells, or even normal cells. So what happens is we have enzymes that do not function well, that break down, and then that's when things build up. And then the lysosomes, which is basically let's think of it as the trash man of the system to clear up in the cells, that's not functioning well. So GBA1, if we can modify that gene, now all of a sudden we're not letting the buildup of some abnormal proteins that create Parkinson's. And so right now there's a study, it's experimental. The experimental drug is called PR001, and it's working in a specific way of delivering the GBA1 gene, the correct version, the functional version of it, and it's allowing for normal levels of what's called glucocerebrosidase. Told you it's a mouthful of words. And
I know.
This allows the enzymes to work better. And now we're going to reduce the accumulation of harmful substances that are going to build up in the key areas of the basal ganglia. And it's a phase 2A study right now. So it's actually shown safety efficacy in certain aspects of the study. And it's called the PROPEL study, PROPEL study. And we're right now looking at the safety, the tolerability, and then see the clinical effects with GBA1 associated Parkinson's. So that's one study that's being worked on. Okay. The second component is what you're asking about is GDNF, and that's glial cell derived neurotrophic factor. And these are, again, different neurotrophic factors. Is basically they support the survival, the growth, and they help differentiate the neurons. And so in the preclinical studies with animals, it's shown that GDNF can improve motor functions and protect the dopamine neurons, in that we've modeled already in Parkinson's disease. And then in clinical trials, though, the situation here is that while the preclinical trials were promising, the clinical trials for GDNF in Parkinson's patients have had mixed results. So some studies have shown improvement with motor symptoms and also dopamine uptake, while others haven't.
I was going to ask what these cutting-edge gene therapies aim to do, but I believe it depends on the therapy we're talking about, right?
Yeah.
So out of everything that's happening right now, which developments are you most excited about personally, for whatever reason?
Yeah, I think the reality is, when we're thinking about Parkinson's specifically, is I'm hoping that we can find a reason for our patient to have the cause of their Parkinson's and say, okay, well, we know it's this gene. I'm going to offer you gene therapy, and you're going to have an alteration of these genes by some form of medication. And then you're going to come back weeks from now, months from now, and realize that your symptoms aren't progressing, or we're not needing the current standard of medicines to help you because your body's actually just fixed it. So, when you have your phone, you sometimes get glitches and it says you need an update, right? Think of this as an update. Think of gene therapy as an update that you can get from your clinician. And then we're talking about total changes in quality of care. So this really hit home, Ursula, when I heard about Leber's optic atrophy and then of blindness, where people who have blindness, all of a sudden they're seeing for their first time. You know what I mean? Like, it's such an impressive feat that you gave someone life again, and it was all because of one abnormal recipe, so to speak, of the way that they were made. All right. So this is what I think is going to be the most exciting part of it. We're going to see this not only just, though, in the Parkinson's world. I mean, I think we're going to see it in hematology with cystic fibrosis and pulmonology areas. I think we're going to see it with other neurological conditions like Huntington's disease.
You once mentioned, because I listened to you very carefully, that 13 to 15% of patients may have a genetic form of the disease of Parkinson's, which actually means that Parkinson's isn't one size fits all. So, do you see gene therapy leading to actually truly personalized medicine for Parkinson's?
Yeah, I see gene therapy being personalized medicine in one way. I do believe that, it's not going to be that here you just take the standard therapies and the one pill is to just help motor symptoms. Like, I truly think that we're going to be able to say that this person has these symptoms and we can actually stop the disease state, so they're not dependent on our generic types of medications that exist. We can actually modify the disease, and it's getting back to the diagnosis, getting treatment early. If we can treat early, we can salvage a lot of the brain health potentially. We can allow for a better quality of life. Patients who are affected by Parkinson's aren't just tremors. You're not defined by your rigidity or the way you walk. It affects you as your soul, right? It affects your emotions. People would get depressed. They can't hang out. They can't do the activities they want. So there's all these barriers that are there. So I do believe that if we can get gene therapy, it will personalize the care for a person far better than we actually have. And we are going to have to do more specific type of concierge care or personalized care, because we're going to have to get more specific blood tests. We're going to have to do genetic counseling, but it will be very specific to each person. And so it will take time, but I do believe that, and there's going to be also a lot of cost involved with the eventual management of gene therapy, but I do believe that there's going to be cures.
Well, you did mention this before, but I would really like to talk about gene therapy beyond Parkinson's. You did mention that blindness, I'm not going to say can be cured, but can be managed with gene therapy. You mentioned Huntington's. So what are the other diseases or conditions that could be improved with gene therapy? You said Huntington's, you said blindness. What else?
So there's a company out there, there's actually several companies that are working really hard and tirelessly. One's called Voyager, another one's called Unicure. And that company is like Unicure, for instance, they're working on a certain therapy. It's called AMT-130, and it's a new investigational gene therapy for the treatment of Huntington's. Huntington's disorder is a neurodegenerative disorder that basically creates these abnormal proteins that then are toxic for areas of the brain, and it causes degeneration. So patients can't walk, they can't talk, they can't speak and swallow well. They create a lot of rigidity. Emotionally, they're disturbed. There's a higher rate of suicide. So what we're seeing is that these abnormal proteins that the genes are making, we can reduce them, turn them off, and then all of a sudden we're making actually the correct natural protein that's then again not creating a problem, not creating destruction, and then the brain can heal itself. So we're going to be able to target using like our for instance gene therapy. It's administered like one time, MRI guided, surgically injected into the area of the brain where we need to. And that the companies that we're working with, for instance, they're doing these studies. And it's actually even shown right now that with the Huntington gene, the phase 1 and phase 2 trials, they've actually shown with AMT-130 that it's actually generally well tolerated. It's been managed well from a safety profile. And the high doses that we're giving of this gene therapy have demonstrated even slowing of the disease progression, so that even there's abnormal levels of what we call neurofilament breakdown of the neurons, that those levels are actually low. So we're seeing less breakdown. So there's going to be an amazing outcome for neural health, especially in the Huntington's world. And I think we can bring that to other genetic issues once we can find those problems. So again, it's quite thrilling.
Dr. Thakkar, I know you're not a fortune teller, but when you talk about these improvements or this, I'm not going to say cures, but let's say improvements, you sound really hopeful. But this is something that could actually be working 100% in 5 years, 10 years, 50 years.
Yeah, I don't know. I don't know. I'm not sure. I'm not sure again about what the future looks like. All I can tell you is that, we have to go through our rigors, our processes properly. We have to make sure that certain things are safe, certain things are tolerable. We don't know the long-term effects of gene therapy or even some of the medicines that we're offering right now. Like, who's to say, like, if we were to get stem cells, that there's some benefits now, but what happens if it creates cancer 5 years or 10 years? We don't know. But I am extremely hopeful. I do believe that gene therapy is going to be extremely beneficial for those that we know that have Parkinson's related to a genetic cause. I do believe that, again, with the scientists that are working on this therapy, we're going to be very direct, and there's going to be certain changes that are going to happen. Now, are we going to cure the disease? Are we going to stop it in its tracks? Very likely stopping it in its tracks. Are we going to actually cure the disease state? I think that's to be determined. And again, I think that we need a lot more clinical research than just 1 or 2 clinical trials.
I'm glad the conversation headed this way, because I was going to ask you about the challenges and the patient considerations, because this is very thrilling. This is, it gives us hope, but we know gene therapy, as any therapy, isn't without challenges.
Yeah.
So some early trials have hit speed bumps. I read about one that had to pause because a patient experienced a serious immune reaction, and that prompted researchers to adjust the approach. So, what are the biggest hurdles scientists still need to overcome before gene therapy is a safe, everyday treatment for Parkinson's? Let's just focus on Parkinson's.
Yeah, so I would say with gene therapy, the biggest challenges researchers are working to overcome right now can include how we target and deliver the therapy, if there's immune response, if there's off-target effects, or there's long-term safety, right? So we'll break it down to immune response. So the body's immune response system can recognize that when we're delivering these genes, that it's through what we call a viral vector. So you can have inflammation, potentially serious side effects in that area where we're delivering the medication of the genes. So we're working on strategies to avoid like the immune response. Maybe we have to give a medicines like certain immunosuppressants potentially to help. That could be part of it, but then it puts maybe people at risk for an infection. How do we target and deliver? We have to make sure that we're also correctly in the right area of the brain, and we're providing improvement to the area and not causing some offsite or other area issues. So we're working at different models of how we inject the gene therapy into that part of the brain. We're using focused ultrasound to maybe break down the barriers of the blood-brain barriers that are maybe limiting how we can get access to these areas. There may be other ways, maybe in the future through IV, but the blood-brain barrier is very difficult to just bypass. So we have to right now surgically implant the genes with gene therapy into the specific area of the brain. So a lot of this is happening through deep brain stimulation. So when patients are getting deep brain stimulation, we're putting actually the gene therapy in those areas. And that's one study that's been going on. We don't know if the body's going to trigger an immune reaction elsewhere. And so these are, again, concerns that we have to monitor for. And these long-term effects, we don't know if they're going to be permanent, if there's something that could create some other issues. So we have, actually, again, this is the whole part of it, that there's a lot of different potential road bumps. Also, manufacturing, the cost of it, producing gene therapies on a large scale can be expensive. It can be complex. We have to work, again, with healthcare industries, insurances to streamline this.
Okay. Every time I listen to you, even though these are very difficult subjects to deal with, but every time I listen to you, I don't know, I'm hopeful that the future is going to look brighter. So I do want to talk about the future and hope, because you've dedicated your career to helping patients with Parkinson's using the tools that we have today, right? Mm-hmm. And you've been doing it for a long time, and you've been succeeding. So on a personal level, how do you feel seeing these new genetic therapies on the horizon? Are you, say, optimistic that in your lifetime, I'm not gonna ask you for 5, 10, or 15, but in your lifetime as a neurologist, these kind of treatments will fundamentally change how you manage Parkinson's day to day? Do you think this will happen in your lifetime?
Yeah, I hope so. I truly hope so. So number one is like, I'm honored that I'm caring for patients right now. I hope I'm making a world of a difference for people, but I can't wait to start telling people that when they come into my clinic, 5 years from now, 10 years from now, that we're going to say, hey, look, I have a disease modifying therapy for you. It can slow down the disease. It potentially can be a cure. I think we, as in movement disorders, us neurologists, neuroscientists, I think it's truly exciting that we have an actual therapy that's very specific to the problem. We're not putting a Band-Aid on this. We are literally getting to the root of the problem. And in that way, we can almost eradicate Parkinson's disease. Now, we're talking about a certain percentage of patients with Parkinson's who have a genetic cause. I don't know if that 13 to 15% will find out that it's actually 80%, right, as time goes on. And as we keep doing genetics, we will find out that there's more genes that are involved. But, there's going to be a way that patients are going to come in, and if they're mindful and they have early detection and they have family members with Parkinson's, they should be getting into the clinic. They should be checking in with us, making sure like, hey, I don't have any symptoms right now, but could I be at risk? This is where I think that we're going to get a lot of hope. We may have patients come in, never had symptoms, and they never ever will get symptoms because we're able to give them a therapy now that may prevent a problem in the future. So I just, can't wait for those opportunities. I'll tell you that as you know, like I told you about my mom had epilepsy, and I was concerned for years as a kid and even as a young adult, like, could I get epilepsy? Could there be a genetic factor? And that weighs heavy on your mind, thinking, am I at risk? Is something going to happen? When is it going to be a problem? And we may not have that issue with Parkinson's, right? We may not have that in the future. So I think it's exciting. And yes, somewhere in my career of practicing, it's going to happen.
Again, I know this is not what I'm going to ask you is not your area of expertise, but when you talk about gene therapy, and it sounds amazing because it does, is this something that would be available to everyone?
I think so. I think it'll be available. I think we have, look, I can only speak to what I get to see right now. Unfortunately, I don't get to see what goes on in other countries, and I don't get to know what the access is for other areas. But I know in the United States, we're going to have access for patients. We're going to have access in certain Western countries. I'm hoping, and I know that there are so many foundations out there that really help in other countries. The Bill Gates Foundation, and there's so many out there. I know that Sergey Brin, who's the owner of Google, he himself has donated millions of dollars. So I believe that around the world, people are going to have access to this type of healthcare. And, it's going to be not just the simplicity of like, you have money or you don't have money. I think there's going to be ways of getting this type of therapy to those who need it.
I wonder, Dr. Thakkar, how do you manage expectations from patients? Because I'm pretty sure that many patients go to your office and go like, but this is happening in India and I want to get it. How do you manage everyone's expectations?
Yeah, everyone's expectations are different. I mean, it's going to be one of those things that we do have to temper them. Again, we can offer what we have available. We can guide people to the right studies. We can guide them to the right centers. But we got to get the right testing first and foremost. So again, stepwise approach. Patients come in. Let's make sure we get the right diagnosis. Let's make sure we're dealing with this component of Parkinson's. Make sure there's no mimickers of Parkinson's. And then we talk about, again, the normal counseling. We have to make sure that they understand what it is. And then we need to understand what the potential ramifications are of therapies. And then that they have to understand that gene therapy is not so simple. It involves, again, surgical implantation right now. Again, in 2025, right now, we're talking about surgically implanting. We don't know in 2026 or in 2030 that this is going to be a tablet form or it's just going to be an IV infusion. So there are going to be changes that are going to happen. And we do need to make sure that right now with the clinical trials we have, if you're a candidate and you want to go for this clinical study, these are the benefits, these are the risks. This is how patients are going to be followed. And so, again, it is tough. But when we deal with someone's life, right, we have to treat them as a person. We have to treat them like the way we want to be ourselves treated. And so those expectations, we need to understand what their true expectations are.
So on this note, finally, for everyone listening, whether they're living with Parkinson's or caring for someone with Parkinson's or just, I don't know, following the science, what is the one message you want them to take away about the future of Parkinson's treatment? And do you believe that staying hopeful and informed about advances, this kind of advances, can make a real difference in their journey?
Oh yeah. So episode 10, we're talking about gene therapy. So in essence, I'm hoping that everyone who comes through this, they're embracing hope, they're staying informed. The whole purpose of this platform is to stay informed. Individuals living with Parkinson's, we're going to change that shift, that we're not just passively managing symptoms, we're actively engaging and participating in curing this disease. We're hopeful for modification. We want to foster resilience, potentially going to be able to access groundbreaking therapies. In our clinic, we're actually working on such things right now that, I can offer gene therapy that I couldn't offer this a year ago. So again, I want to have that proactive mindset, right? I want to foster that. Our patients right now on the verge of some unique groundbreaking therapies that, again, aren't going to be necessarily even offered for potentially 8 years from now, right? So if we have clinical studies that we have available, patients have they're at the ground floor. So it's exciting times.
Okay, so I do want to ask you before letting you go, how do you manage your own expectations?
A deep breath first. Always have to temper how my excitement for things is that there's always good and there's always bad, and you can't get too high and you can't get too low. So one of the things is I keep informed, keep with reading. I think I'm grounded by my patients that I see on a day-to-day basis. Keep level-minded by my wife and my kids, and there's always going to be things that get us excited, but we just can't get too over the top of it. But at that same time, life comes with a lot of heartbreaks. And so I'm going to make sure that we understand that there's an opportunity here. We have some great opportunities, and there are always the pros and cons, right? There's always those potential side effects and risk factors. So there's not going to be a perfect type of medicine out there, but we have to individualize it. So yeah, my life experience gives me that kind of balance.
Dr. Thakkar, thank you so much. We've wrapped up episode 10, which is unbelievable. And again, it's been so interesting and so fulfilling to hear you. Is there any last message you'd like to leave our audience with?
Yeah, it's around this time of this recording, right? Ozzy Osbourne just had passed away, and he suffered with Parkinson's, and the stories that have come in about him, I never got to meet him, but he was a courageous soul, and just a great artist, musician, and again, it doesn't matter if you're a celebrity, if you're an average Joe. This disease takes a toll on us, but again, it is important that we live our life to the fullest. It's extremely important to work with your neurologist, enjoy time with your family. I think this is, again, it's an important aspect that we can all suffer potentially from this disease, but don't let it overtake you. You're not defined by this disease. So again, it just seems so amazing what I hear about Ozzy Osbourne. Yes, it's like a little blurb that yes, he had Parkinson's, but he didn't die from Parkinson's, right? But he lived such an amazing life, and that's the way that I want everyone to think, that even if they get diagnosed, they are more than the disease.
He was on stage 2 weeks before he died, actually.
Isn't it impressive? Yeah.
Thank you so much for your time, and I look forward to episode 11.
All right, thank you. Appreciate it.